Hi, I'm Dr. Morgan. I'm a family nurse practitioner. And today I'm talking to Richard Graham. He's a ICU nurse. And our topic will be nursing from a male's perspective. A little bit about myself. I am a family nurse practitioner who treats patients both in office and virtually. To reach me virtually, you can set up a request on PushHealth, and my invite code is CMorgan08. And you can reach me at my in-office at Abigail Healthcare at 281-832-8490. And Richard, you're going to tell us a little bit about yourself.
Sure. My name is Richard. I am an ICU nurse. I'm currently a travel nurse on assignment in Maryland, but I am lucky enough to be home at this point. I've been an ICU nurse for actually 3 years now, and I feel lucky to be on this podcast with Cheryl.
Okay, thank you so much, Richard. And today we're talking about nursing from a male's perspective. And we know that nursing was associated with the female gender. We know about all of those icons, namely Florence Nightingale, Mary Seacole. And when somebody mentioned the word nurse, automatically we picture a female. And when somebody say the word doctor, we automatically picture a male. And even now, some female doctors are fighting with the problem where patients are calling them their nurse because they do not want to identify a female as a doctor because they think it's a predominantly male profession. So as a nurse, I know that you probably walk into a room several times and they will ask you, are you my doctor? So as a nurse practitioner, we female nurses are also facing some problems where the male nurse practitioner might be easily hired and they might be paid more as well, for that job. And more males are now entering the nursing profession, and I think they're also attracting higher pay. And we're going to go into that, based on the type of work that a male nurse can do that a female nurse might not be able to do. So when you became a nurse, how were you received by patients?
Well, that's kind of a loaded question. The reason why I say it's a loaded question is for the fact that I, generally speaking, don't really fit into the criteria of the typical male nurse. So because of that, I feel like I'm received differently at times. You are right. A lot of times I walk into the room and the patients think I am their doctor, and I am quick to correct them and say, no, I'm your nurse. I take a lot of pride in being a nurse. Male or female, I think it's a fantastic profession. And like I said, as soon as I go in a room, someone calls me, oh, doctor. I say, no, I'm your nurse. So as far as the way I'm received, it depends on the patient. It depends on the age. With a lot of male patients, they actually appreciate the fact that they have a guy because of privacy reasons. Not every male patient feels free when there's a female nurse in the room. So, of course, for obvious reasons. And as far as women go, it depends on the woman. Older women a lot of times don't mind. Younger women sometimes will mind more, but then it goes the other way as well. There's a lot of older women that are very reserved and they prefer female nurses as well. So like I said, it all depends on the situation, it all depends on the person who I'm in charge of.
Okay, that's excellent. That's excellent. And I could see why maybe a younger female might not be comfortable with a male. And for the guys, yes, I do understand that as well, because as a female nurse practitioner, whenever I'm to deal with a male with a genital issue or a male issue that I call them, they're a little bit shy and reserved in coming forth and telling me what's going on. For my online practice, which is easier, sometimes they prefer to send me written communication instead of talking to me. So even if I call them, they're like, I don't want to talk. I prefer to text you because they're embarrassed, but a female would be, relatable. She might relate to me easier. So my next question to you is, a male doctor can be a gynecologist and whatever field specialty they do in medicine, female patients receive them readily. But when I worked as a nurse at the bedside, a female patient would not be comfortable with a male nurse performing the same task that the male doctor performs. So have you ever had any instances where you were, rejected or come up against any resistance from a female patient in performing your nursing duty? And how do you deal with that? Or how would you deal with it if you have not experienced it yet?
So when I first go into a room, of course, the first thing is we do, as any nurse would do, is you survey. You can walk into a room, generally speaking, you can figure out, okay, the patient's not going to want me to do this. The patient is going to be okay with me doing this. As nurses, we're pretty good at kind of sensing that out. A lot of times when I walk in and I see that there is a female in the room, or when I get report and I find out I'm taking care of a female patient, the first thing I ask them is, what are you comfortable with me doing and what are you not comfortable with me doing? So I'm kind of proactive in that. So I'm not necessarily rejected. So say, for example, working in the ICU, a lot of times our patients are intubated, they're sedated, they're on some type of sedation. So that being said, you do have patients that are in and out of confusion. So what I generally speaking do is I usually bring a female nurse into the room with me. And that's to protect myself, as well as letting the patient know that you have options. Just because I'm your nurse doesn't mean that, you don't have the option to say, I'm not comfortable with you doing this, or, so forth. The other thing I do a lot of times is I barter with the other nurses. If I have a female patient and say they need a Foley catheter, what I will do is I'll barter with another nurse and I'll say, hey, listen, I have a female patient, and can you, place a Foley for me, or can you do this for me? Something that, the patient may not feel comfortable doing. I will say, if you do this for me, I can do this for you, and it usually works out pretty well. So, I try to do that. So I'm not in the situation where the patient does not feel comfortable.
Okay, that's great. So one of my experiences working on a rehab floor when I was a registered nurse was those patients needed a lot of lifting and turning. And we do have one male nurse on the floor, and every female nurse would go to that guy and say, can you help me lift? Can you help me turn? And after a month or so, he was like, guys, I know that I'm a guy and I am strong, but I'm tired. I'm having back pain because everybody calls me to do something. So have you been in that situation, and how did you deal with it?
So there is this viral little meme that was going around once about what my wife thinks of me as a male nurse versus what being a male nurse really is. And the meme basically was, from his wife's perspective, everybody's like, very happy that he's there and everybody's flirting with him and this and that. But in our reality, what it really is, yeah, we tend to do a lot of the heavy lifting. And personally, for me, I'm okay with that. I'm still young and strapping. So I try to help out as much as I can within my means. So yes, I'm very used to people saying, hey, can you help us lift this patient? Or, I have this water bottle that needs to be placed on the cooler. Can you do that for me? So it's stuff like that that I'm very used to doing. And I honestly don't mind doing it.
Okay, that's great. I certainly do appreciate male nurses when they are around, because it's a different energy. Because sometimes when there's too much feminine energy, you already know how that goes. You have a whole different conversation with the guys, and it creates a balance. So I do think having male nurses in the profession really, really, uplift the profession. And I kind of like it a lot, So in terms of salary, do you think there's a disparity in the salaries between male nurses and female nurses?
So I think that there can be. So I work basically as a travel nurse. So there's, salary for the most part is the same across the board, depending on your contract. But as a staff nurse, there can be situations where a male nurse will enter with a higher salary. And I think it's for many different reasons. I think one reason is a lot of places want male nurses for the heavy lifting or for the patient control sometimes. There's situations where patients get out of hand. And when that happens, I'm usually the first one there in the room to try to calm down the situation, because I understand, especially if it's a male patient, I'm not going to let, 3/4 of my female counterparts walk into a room and just sit there while they're having a hard time with this patient. So I think there's that aspect of it. But in general, we all know that no matter what field it is, men, generally speaking, do tend to get paid more. I also think, though, with more males entering the field, we are very salary competitive as men. We don't necessarily, I don't want to say put up with, but a lot of women in the field, the belief before was, oh, I have to do my job. And even the concept of you're lucky to have a job, because as a nurse, when the profession of nursing first came around, women could do one of three things: secretary, nurse, or teacher. That being said, the mindset was, well, you're a woman, you're lucky to have a job. That's now changing, especially because, women are more empowered. And I believe that in the field, if women put their foot down more and say, listen, I'm not okay with this, I'm not okay with that, as per se how it used to be, where it was, well, I have to do this because they told me to do this. I believe that, that will have an impact not only on their salary, but my salary as well, to help me lift up my salary.
Okay, you have raised some good points. Some areas where I would see they prefer male nurses would be psychiatry, definitely surgery, to with the lifting, moving patient from the stretcher to a surgical table and all of that. ER as well, emergency room, and in the area where you are, ICU. They need the manpower in those areas. But in talking about, women putting their feet down, I think a lot of places will prefer to employ men, because men don't usually argue, whine about things. Women will whine more. Everything we tend to complain a little bit more. So while the guy will okay, I'm fine with that, the women will argue about it. But the next area that I think most places will hire male over female is because of the amount of time off that the female will take from work. So you as a male, Richard, you only probably need to go to your doctor one time for the year to do your annual, and that's about it. If you are 45 and need to get your colonoscopy done, then you will need another day. For the female, she needs 1 day to go to her primary care for her annual physical. She needs another day to go see her OB/GYN to get her well woman done. She needs another day to go do her mammogram if she's in the age where mammogram is taken. Then talking about taking the kids to the doctor for their doctor's appointment, it usually fall back on the female. Also, maternity leave is another big area where a lot of workplaces see where they're losing revenue to pay a female on maternity leave while paying another person to replace them. So things like that, I don't know if there's any way going around that. But I think that's the area where a lot of workplaces are actually leaning toward hiring more male, and they will pay the male more because the male literally are on the job more days than the female would have been. What are your thoughts on that?
I can understand where you're coming from, because those are facts. Generally speaking, women do have to take more time off to go to doctor's visits, to take care of their children's doctor's visits, because let's face it, most fathers or most husbands aren't going to take that time off and do it. Luckily for my wife, I do that, but let's be honest, in this day and age, we're still at a point where men are not the ones to, generally speaking, do that. Moving forward, I hope that men and fathers do take the time off to be able to do this with their children. But like I said, I understand where you're coming from with taking time off. Circling back, I think also you made an interesting statement about men in the workplace as far as nurses, that we're more inclined to just say, okay, it's fine, I'll do it. And yeah, I believe that's true. I see it where I'm working right now, where I'm just like, hey, it's okay, I'll do it. It's not a big deal for me. But I think that comes with more of the frustration of the female nurse of always, being told, oh, you have to do this or you have to do that. And it gets overwhelming. It does. Generally speaking, for the most part, men don't get overwhelmed as easily as women do, because we don't tie the emotion along with things as most women do. But then again, at the same time, if you ask a male nurse, hey, are you gonna change that garbage? You know what they're gonna say? No, that's not my job. And that's just the facts. Male nurses are not gonna change the garbage, while the female nurses will. And that goes back on, once again, as the field changes and more males come into it, it's just like, okay, well, I'm being paid to be a nurse. I'm not being paid to do this, and this. While women in the field have always said, okay, well, I have to do this, 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 which once again compiles the things that they have to do. So going back to it, if female nurses put their foot down and say, well, you know what? No, we have people to do that. So why do I need to do that?
I think as female, we like to fix everything. And that's one of our problems.
but what comes with that same problem is the bombardment of things to do.
Yes.
Don't get me wrong. If there's a garbage to be changed, I will change the garbage. But I know male nurses that refuse to change the garbage. And their whole mindset is, that's what environmental's for. They don't pay me to do that, so I'm not going to do it. If they want me to do it, pay me to do that as well. So
I also noticed, Richard, that when I used to work in the hospital, I would be nursing a patient, and when I go into the room for the morning, the patient would like, oh, can you do this? Can you do that? And they will ask you to do a lot of things. If the male nurses go in that room, it's all smiles,
yes,
fixing up, and do you need anything? I'm fine.
Yes, and that's another thing. A lot of patients feel inclined to ask a woman to do something for them. And especially cultural, that's one of the things that we focus on in nursing. It's a lot of cultural things where male nurses do get respect from other cultures. And it's just like, oh, I would never ask my male nurse to do that. But like you said, a female nurse walks in and it's just like, oh, can you fluff my pillow? It's those little things. And that kind of is one of the perks of being a male nurse is, generally speaking, a patient's not going to ask you to do as much as they will a female nurse. But once again, I do notice those things. And what I do a lot of times is when I walk into the room, even before I leave the room, I say, is there anything else I can do for you? Do you need this to be fixed? Do you need that to be fixed? Because one of the perceptions of male nurses are, we're not as caring. But we are. well, I can't speak for everybody, but I know for myself that I am caring because I do enjoy what I do. And I understand that people are in their vulnerable states when they're in hospital. The first thing I want to do is make them as comfortable as possible and know that I'm there to take care of them.
Thank you so much, Richard, for being one of the males who stepped forward to join the profession and to help to change the face of nursing, to shift it from a stereotype as a female profession, and to show that, you do have, compassion, emotion, you do care, and you're equally trained and qualified to perform the duties that female nurses carry out. And we enjoy seeing you guys in all the areas, whether med-surg, tele, ICU, psych, ICU, wherever you work. It brings a different energy and it brings a balance. And a lot of people, if they've never been in a situation where they're in the hospital, they would never know that a man could be a nurse. I remember trying to encourage my brother back in Jamaica to be a nurse. And he's like, no, I can't do that. That's a female thing. And I was educating him to let him know that male nurses, they're male nurses and they get good pay and they're well respected in the hospital. So you are just one of them who, step up to the plate. And I really appreciate that. You're doing a great job. And Richard and I go back from far, and he's an awesome, awesome guy. And for those of you who will comment, drop in the comment who Richard looks like.
Not funny.
Do you have anything to say in closing, Richard? We're going to wrap up.
Just thank you for having me on. It's been a pleasure joining you on your podcast. I look forward to possibly returning. And it's also interesting hearing it from a female's perspective, because a lot of times, I may work with them, but I don't understand, the way they're thinking and the things that they go through. So it's very interesting hearing it from a female's perspective, and I do appreciate that. Okay, great. So I'm going to wrap up. Thank you so much. This was Health Talk with Dr. Morgan and Richard Graham. It's not him, okay, guys? That's Richard Graham. He's an ICU nurse, and hopefully I will bring back Richard on to have other discussions about nursing. Thank you so much. Have a great day. Bye-bye. Thank you. How was that?